a co-founder and CEO of Thread, and I am thrilled to welcome you to the Thread Speaker Series. Thank you for joining us for this new forum that is sharing inspiring ideas from exceptional leaders. Each week, we are shining a light on diverse leaders who are models for how others can drive sustained change through coordinated and consistent interventions in intrapersonal, interpersonal, institutional, community, and policy domains. At Thread, we believe that relationships are at the heart of change, whether that is individual growth or systemic shifts and everything in between. By building intentional relationships across lines of difference, we know that we can break down structural barriers that exist and build a society that recognizes the intrinsic value of each human being. I'd encourage anyone who is unfamiliar with or new to Thread, or who wants to develop those skills and build deep connections with others in our city, to visit our website at thread.org. Tonight, we are broadcasting from Church of the Redeemer in Northwest Baltimore. We are excited to have in-person guests as well as virtually on Zoom, and to hear from Dr. Letitia Dzirasa and Dr. Joshua Sharfstein. Dr. Dzirasa is a board-certified pediatrician and has served as a health commissioner for Baltimore City since 2019. She began leading Baltimore City through the global pandemic just a year into her tenure. Her areas of expertise include pediatrics, public health policy, and the social determinants of health, and creating opportunities for equitable access to healthcare for all. Dr. Sharfstein is the Vice Dean for Public Health Practice and Community Engagement, Director of the Bloomberg American Health Initiative, and Professor of the Practice in Health Policy and Management. Previously, he served as the Secretary of the Maryland Department of Health and Mental Hygiene, the Principal Deputy Commissioner of the U.S. Food and Drug Administration, and also the Commissioner of Health for Baltimore City. Please join me in welcoming these esteemed guests. What I would just want to add before I turn it over to them for what is going to be a truly remarkable Baltimore story is just how much gratitude the Thread community feels to be able to hear from both of them. I can't fathom what Dr. Dzirasa has been through running the health department in a global pandemic over the last few years. And Dr. Sharfstein just flew from Barcelona to Los Angeles, back to Baltimore, just to be with us here tonight. So I appreciate all of you joining us, and I'm just so deeply grateful that they are here to tell us this incredible story. Thank you.
Thanks so much, Sarah. It's great to be here. And we flipped a coin and I get the first question. That was a joke. Okay. So can you hear me? Nobody can hear me. All right, let's try it again. Can you hear me now? Okay, so I'm going to try again. I said we flipped a coin and I get the first question. All right. All right, we'll try. All right, we'll do better this. So Dr. Dzirasa, it is great to be here with you again.
It's always great to be here with Josh. Can you? I still can't hear you. Oh boy.
Maybe can I hold it like this? Is that better? Okay. I knew it's not my ear. Okay. It's a little better. Yeah. It is to be here with you.
It is always great to be here with Josh. Josh and I have done this multiple times during the pandemic. So good, but I think this is our first time doing it in person. So
we've
yeah.
done it on Zoom.
Yeah.
Okay. So I want to take you back to when you were applying to be the health commissioner.
Yes.
And if I recall correctly, I was in your interview.
You were.
It was 2019, 2018?
Like December 2018.
December 2018.
Yep.
And I don't recall that your top priority was pandemic preparedness.
Definitely didn't make the list. No.
Yeah.
No.
So let's just go back to that moment. You know, you are a pediatrician, you worked in health IT, you worked in school health.
Yep.
Why did you want to work in public health?
Oh, that's such a great question. And I'm going to share maybe a little bit of my history, and hopefully you guys can hear me okay, and how I got here, because I think my history and how I got here helps to better explain why this role kind of made sense for me. You feel good on sound? No.
All right. Yeah.
So I grew up in Maryland. So I grew up in Prince George's County, not too far from here. Always knew I wanted to go into medicine. So my mom loves to tell the story that when I was 8, I told people that I wanted to help people who didn't have insurance get healthcare. Right. And what 8-year-old even knows what that means? I had no idea. But certainly early on, I think had this passion to give back.
Excellent.
So early on, I think I had this passion to give back. I went to the University of Maryland, Baltimore County, where I was a Meyerhoff Scholar. And I think, that program, which focused on very much on certainly this internal community, but also externally giving back, helps you, I think, further lay the foundation of what I knew I wanted to do. So I went to Meharry Medical College, a historically Black college and medical school in Nashville, Tennessee. And again, their motto is actually service to God through service to mankind. So, all throughout, even that early training, there was this notion that everything that we do is intended to give back, right? And so I trained at Hopkins, and so got to work and spend time in East Baltimore. And one of my quality improvement projects there was actually developing a resource guide for residents in East Baltimore. So it was like in a binder. So, that tells you when I did residency, but it was in a binder, and literally my cohort and I, we put together this binder of community resources for residents in East Baltimore. I would like to remind Josh, I also spent a month at the health department when Josh was health commissioner, and actually supported some work for Be More for Healthy Babies. So I know Josh doesn't remember, but I presented to Josh. I was very nervous. Again, I think it was even in working that month that I spent there, like, this is what I want to do. I don't know that I had like the traditional path to get there, but I think it was always there, and I always knew like this is what I want to do. So that kind of defines part of the early educational experiences. I think that helped to guide me there.
So you get started, and what are your initial priorities?
Oh, my initial priorities, again, I'm a pediatrician by training. And so, and I love school health. So certainly still had a passion to utilize our school health centers, our school-based health centers, to provide access to care. So expanding some of the work we were doing in school health, which we're still doing a lot of work in school health, but have now experienced a nursing shortage and turnover, obesity prevention and management, especially among young people, better addressing youth violence. And so really using trauma-informed care practices to address youth violence. And I wanted to update and share how we use data in the health department. So I did get to do some of those things, but working on so many other things.
So you really were just getting used to the health department.
I just learned where the bathroom was, I think.
Yeah.
Yeah.
And then you have a once in 100-year pandemic. And at what point did you realize that this was not like something you were managing on the side, that this was really going to take over the health department's work and the city's, present?
Yeah. You know what it was? It was sitting in a room with other agency leaders. And this was kind of before I think we had a real sense. We're in this tight little room trying to figure out if we're going to have the St. Patrick's Day parade. Like it's like, I remember DOT was there and police were there and fire was there. And it's like, so do we think we're going to do the St. Patrick's Day parade this year? And having to kind of make that call. And I was fortunate, very fortunate to have great support on the city side to be able to make that call.
And how did that go? The mayor was okay.
Yeah, he was actually, again, I think so much was unknown and there was such uncertainty. I think they were looking to the person who they thought had the most experience in a global pandemic, which I guess was me, to really help guide those decisions.
It's very interesting. At one point I interviewed the health commissioner of Columbus, Ohio, and she had to cancel a conference right at the beginning.
Yeah.
And she was also backed up.
Yep.
by her elected leaders to do that. And that also put her on a path, I think, to
Mhm.
really
Mhm.
be a great leader during the pandemic like you were. Now, I want to shift gears a little. You have a pandemic coming to Baltimore.
Yeah.
Baltimore is a city with, incredible strengths and incredible challenges, structural problems that affect housing, that affect transportation, that affect nutrition, chronic disease levels are high. All the things that we know now are risk factors for death from COVID. And, there's no question at the beginning of the pandemic, there are health commissioners all over the country thinking this is a problem, but you got to be thinking this is a big problem.
Yeah.
That all of the long-standing serious issues affecting Baltimore are now, could be exploited by the virus, are going to be exploited
Yeah.
by the virus, and just how bad is it going to be? And I just want to skip all the way to the end of the story and say it wasn't as bad as maybe we thought. I remember headlines about Detroit, about New Orleans, about New York,
Mhm.
Los Angeles. I don't remember any national headlines at all
Yeah.
about Baltimore in the pandemic. And
Yeah. I think our headlines were when we kept the mask mandate in place.
yeah, you kept the mask mandate in place, but and at one point, we had a faculty member who compared all the counties against each other using a previously described set of counties that are comparable to Baltimore. And Baltimore was among the lowest in mortality, among the highest in vaccination rates. So this is a story that I want to, elicit,
Yeah.
like how we went from someone who was, pretty new in the job,
Yeah.
canceling a parade, and having to lead through a pandemic. And in the end, the city, um, could have been worse, which is, it could have been a lot worse, really. And tell me about what that experience was like. Where did you, now we're going to go back,
Yeah.
what were those initial crazy times like for you?
Wow. That is a big question. I think the first thing I'll say is that, when I think about, the success of Baltimore, I think it's not on any one entity or one person, right? And so I think early on, the city was approached by Hopkins Health System, University of Maryland Medical System, Care First to form a public-private partnership. And I think really early on, and I think, Josh, I remember having a conversation with you one night when I was still at the health department, it was very late. And, just recognizing early on that the city, and by city, I'm maybe like kind of city leadership government, was not going to be able to do it alone. Right. And so when we were approached to form that partnership, we had city leadership that also recognized the same thing, right? That this is going to have to be, a public-private partnership of epic proportions in order to be able to respond accordingly to what we thought might be coming. And so I think that helped early on, certainly with the overall response, but I think also with just creating an environment where partnership was the norm, right? That it was never any one person who, again, was going to do it all, but that we were going to work with partners from day one, still working with many of those partners. And many of those partnerships were not just leveraged, but were really strengthened during the pandemic.
So I want to talk about different kinds of partnerships that you set up. So there was one kind that you mentioned with some of the institutions of the city. You had University of Maryland and Hopkins doing testing. You had
Yes.
phone line that they set up
And Care First was supporting the phone line too. Yep.
that people could call and get referred to testing at a time when a lot of other places, you didn't have a doctor connected to someplace, you couldn't get tested. They were doing mobile testing. You were setting up sites. That eventually became a huge mobile vaccination program that went around the city. And it even became a hotel.
Yeah.
People who were homeless and needed support 24 hours. You had the convention center get staff. So there was a lot going on at that level.
Yeah.
But that wasn't the only kind of partnership that you set up.
Yeah, I mean, I think two other critical ones was the Baltimore Health Corps, And so again, recognizing public health has been so underfunded for many decades, we didn't have the workforce to be able to rapidly respond to new cases. And even with testing being as slow as it was, being able to quickly grow a team of contact tracers and case investigators, being able to expand that workforce. Hopkins was an early partner with the SORT students, but our team, like I think our acute communicable diseases team was less than 15 people. And so we needed to grow that quickly. So Rockefeller came in as one of the initial donors. The city supported with CARES funding to develop something called the Baltimore Health Corps, which was essentially hiring about 250 city residents with the focus on both workforce development and public health education and outreach, which included case investigation and contact tracing. And we focused on specifically hiring people in communities that had been most impacted on, Spanish speakers, again, recognizing who were our communities that were already pretty hardly hit. And we wanted to make sure that we were hiring people that were unemployed or underemployed as a result of the pandemic.
It was a combination of a program of economic development and jobs with a pandemic control program. Now, the state of Maryland, facing a similar issue, contracted out to a call center, I think in Illinois.
Yeah.
You hired 250 community residents in Baltimore City. Why did you do that?
So, again, I think it was, and I shouted out Rockefeller as one of our donors, but they were one of many. We had many local philanthropic partners who early on asked, how can we help? And the Baltimore Health Corps program, I think, was really just the perfect opportunity to bring in local donors, because I know that local donors in Baltimore have a true heart for Baltimore. And that's really what this program was about. Certainly serving the residents of Baltimore through those folks that we hired, but then actually hiring people that are Baltimore residents that had already been impacted by the pandemic, by losing their job. And so, we knew that we were going to need that local support in order to be successful. Certainly if I've learned nothing else in this role, Baltimore is a big, small town, and it's a town about relationships. And so again, hiring directly from the community, we had kind of that built-in relationship factor of people who lived where they were working and serving.
Tell me about the other kinds of support you got from organizations. I think the NAACP was doing announcements pretty early on with support and partnership with the city.
Yeah, absolutely. I mean, when we think about messaging, I think something else that we also knew is that it was going to have to be tailored and specific for different populations, right? We knew that it was not going to be a message where one size fit all. And so had early outreach from the NAACP, who was going around doing messaging. They were doing announcements. We did focus groups early on to better refine our messaging for specific groups and communities as well. But the NAACP was a great partner in spreading the message throughout the African American community.
You had a coalition that was meeting regularly with a lot of data on certain parts of the city and certain populations that you're particularly concerned about, showing data.
Yeah. So we had our COVID external task force, which probably still just met last month. we're probably just now starting to look at the cadence, because we thought it was important that people understood that we were looking at this at a CSA level, right? We were looking at this at a neighborhood at a CSA level, and again, targeting our approach and our focus where we knew the needs were greatest. So this COVID external task force held many external partners, community members, community-based organizations, certainly our academic centers, our federally qualified health centers, and we would do a robust and thorough data review. We would talk about kind of where we were in terms of vaccinating, and we would break it down by population. Where were we still challenged? Because I think it also created the opportunity for those partners who said, I want to step in, I want to help here, I want to support here, to know exactly where here was.
I can tell you, during the pandemic, I was involved in advising different city governments. People were calling me from different parts of the country, and they were amazed when I explained that you had basically everyone dialing in every week
Yeah.
and chipping in ideas and offering to help. Whereas in other places, they were consumed with finger pointing and, everything was playing out in the media. And
Yeah.
I have to say, I think that some of that really is to your credit directly, because I think people really look to you as a leader. They appreciate you exude the compassion of a pediatrician, that you're there for the right reason. You've got your heart in it, and here's what you're doing, and you make people want to join you rather than stand outside and kind of wag their finger. And the conditions were right for that, but I have to tell you, I was sending your slides to other cities so that they could kind of see the kind of thing that they potentially could do, and they were all very impressed.
No, thank you.
Um, Now, I do want to just for a quick second talk about the elected leadership. One of the things that I always appreciated was that people care about public health in Baltimore. And you were the health commissioner in the middle of a mayor's election, which is a little tricky to do. I was the health commissioner in the middle of a governor's election, and I don't recommend that for anyone's health. You were the health commissioner in the middle of the mayor's election, which is, I'm sure, just as challenging. What I found really interesting is I offered to every candidate for mayor and city council that if this was very early, because it was like March, I think, when 2020, when that primary was happening, that if they wanted someone to come onto a campaign call just to talk about the virus on an equal basis to all the campaigns I was offering, and every single one took me up on it.
Yeah.
And all of them put out good information. Yeah. It was not the case that there was a serious candidate who was, questioning what you were doing, or telling people, don't worry about this. To a person, they were, very, very clear. And it really was not politicized. And even to the point where I remember a particular press conference I think I was watching, or I might have been there in the background with Mayor Scott, where he was asked, well, the other counties have done something differently, but how come you're sticking with the mask mandate a little bit longer for indoors? And he didn't miss a beat, and he said, because I listened to my health commissioner.
Yes. Yeah.
And so tell me about your perspective on that. What was it like? Because I have to tell you, another national comparison, hundreds of health officials lost their job, in part because of stress between the elected officials and health commissioner. That did not happen in Baltimore. Why not?
And I have many friends who, I have personal friends who, reported getting death threats or were told, I know where your children go to school. So it was rough across the country. I have to say, I didn't experience that. I had such support from the leadership from both administrations that have worked during the pandemic. I think with both of them, I had relationships with them prior to them becoming mayor. And so I think that helped. I think that lended credibility to, again, they knew me, they had worked with me, somewhat. And so they knew my character. They knew that I was going to, work with integrity, and that I felt my job was to serve. So, early on, just always had that support. Even when Mayor Scott, when he was just prior to the general election, when he had pretty much won already, but wasn't quite in the role, meeting with him regularly. Even before he took office, to make sure that he understood where we were. And I think that was appreciated, right? Like, I'm not yet in this role, but I'm preparing for it, and you're helping me to prepare for this.
So now, one more question about the throes of the pandemic, and then I want to talk about some of the other issues personally. It was a long time. It was a lot of stress. You probably did hundreds of events, talking to people, answering people's questions. What did you do to, and I'll also say, very hard on your staff. The health department works incredibly hard, and doesn't quite get the thank yous maybe that you do. They're in the ballot chip.
Mhm.
and you're the captain. What did you do both for yourself and for them? I'm doing.
Yeah, great question. I definitely think, to your point, my staff, you think I work hard, my staff works harder. And I think again, I will give them the credit that I'm able to sit up here and talk about the great work because they did the great work. And so I think for me, um, early on, we really, in terms of giving staff relief, we tried to institute a policy where we would stagger schedules. I mean, we tried many things. I will say, again, to my staff's commitment and dedication, many of them did not want to take off. Like, we had to force people to take time off. I worked to get bonuses for people who they had built up so much time and they couldn't take it off, right? Because now, like, it's just going into the abyss. And so, really working to get compensation for those folks who weren't able to use that time. I think, again, focusing on maybe the first year and a half, it was hard for no one really, I feel like, took time off. I would say a year and a half in, it did become like, no, you should sit down. You should take time off. And I think when I finally did that, it gave my staff permission. I think they were kind of waiting on me to do it, and then they felt like, oh, okay, well, she took time off, so maybe it's okay. And so really trying to set that example, which was definitely challenging. I think on a personal level, I'm fortunate that I had my son at the time when the pandemic started, had just turned 3. And so I had a lot of support at home. My husband, who was working from home at the time and had sitters, had wonderful sitters. I cannot thank my sitters enough, who really helped with getting him ready and making sure that he was well taken care of. And I exercised throughout the pandemic. So people ask me, like, I can't believe you exercise, but I would not have survived, I think, if I didn't exercise 4 to 5 days a week during the pandemic, and still do.
And tell us about this bottle.
So it hasn't gone off yet, but this is measuring my water intake, because I am that person, so that I make sure I hit my water goals each day.
This is the difference between you and me. You are hitting your water goals, and I got a kidney stone.
Yeah.
Um, so I don't want to overstate the case, right? The pandemic was really a devastating event for the city. Baltimore, I think, overperformed expectations, and I think your leadership and so much work by so many citizens of the city, so many groups that, at every level made that possible. But if you look at the map of COVID, it looks like the map of many health challenges, which, has its legacy in all kinds of redlining and different kinds of discrimination in the history of the city. And this is true for COVID across the country. It made plain what people in public health had known about lead poisoning or chronic illness, or for that matter, overdoses and violence. How does public health change as we're moving out of this more acute phase? And what can public health do to address some of those structural issues?
Yeah. I mean, I think the first thing I'll definitely say that the pandemic did, maybe in a, if we want to put it in a positive light, is I think it highlighted that for many people outside of public health who didn't know. And so if you think that maybe knowledge and awareness are the first step, I think it did bring, these disparities that, again, many working in healthcare, working in public health already knew about, really to the forefront, and I think made it a larger issue for everyone, right? And so I think that certainly is very helpful. I think another thing that to what we know about kind of the underfunding of public health, it highlighted these fractures in our existing system, right? It highlighted that we had a health department who year after year had seen budget cuts, and so we didn't have the staff to rapidly start to do contact tracing and case investigation. We had a very small Office of Public Health Preparedness and Response, and they too had to, like, how do we hire rapidly, and how do we make sure that all of the plans that we have on paper, we can actually execute on. And so certainly if we do one thing, I think it's that we become better prepared, right? Like we now know these things. And so I think to not do anything differently, to not, seek to change the system, to not look at how we can better fund public health would be silly. One of the challenges I think that we will face is, we're funding now, but how do we really encourage that funding to be sustainable and long term?
Right. You mean you've got some extra pandemic funding,
I have some extra pandemic funding for now.
right? Which is like boom or bust for public health.
Yep.
I think I was the health commissioner when there was a brief panic about bird flu. Suddenly, in the middle of everything in Baltimore, everybody was running around on bird flu. And I remember vividly a conference I went to. It was sort of like, you got to go to this conference. And what I remember from the conference was that the lunch was extremely good. It was a very nice catered lunch. And I was like, wow, that's a nice lunch. This must be an expensive conference. And then during the afternoon, they rolled in a little freezer of Dove bar pops. And everybody had a Dove bar pop. And at one point, one of the people was with the Dove bar pop was going, we need this on bird flu and that on bird flu. And I thought something is wrong with this picture.
Yeah.
That this, like, for so many things that we worked on in the city, homelessness or child preparedness for school, infant mortality with Be More for Healthy Babies. We didn't have Dove bar pops rolled in a little freezer, And so public health gets funded when you're in the headlines and then it drops off. It's hard to plan. One of the things nationally that people are talking about is really hiring more people from communities to do the work of public health and creating job ladders, into public health as a field. There are always, outreach workers here or there, but really as a community health workforce for public health, which frankly, Baltimore did during the pandemic. Funding pending, is that kind of direction that you'd like to go? And if so, what kinds of issues do you think they could be helpful?
Yeah, absolutely. So again, I think the health department has a lot of community health workers. I see some health department staff in the background. So we have a lot of community health workers. And so even pre-pandemic, my CMO and I were talking about, one, how do we kind of standardize the role and the training of a community health worker, right? Because I think that means different things to different programs within the health department. So we had already been discussing what would it look like to kind of have this standardized requirements for community health workers, to maybe even be a training site for community health workers, to subsequently come together to advocate for reimbursement for community health workers. That was already in the works. And so when the pandemic hits, and we need even more community health workers. And so again, the innovative, solution that my staff came up with was something called our value ambassadors. And so going back to knowing that there were going to be communities that were hardest hit, we kind of selected 10 of those different populations and assigned value ambassadors, which are essentially community health workers, to go out and to be the educator, to help support vaccination interest, to answer questions on vaccination, to canvass ahead of vaccination events in the communities. And we're still working with many of those. So while early on, the strategy was, okay, let's take these 10 populations, hire from within those populations, make sure that we're educating and going from neighborhood to neighborhood. We're now even looking at an even more granular level and looking at CSAs and neighborhoods where vaccination rates are lower than 40%, because those citywide, we've done well. We know that there are still communities where, there's a percentage of the population who haven't had their first vaccine. And we have children who are not yet vaccinated. And so we've shifted those same value ambassadors that were doing the work for these kind of larger populations are now really focused on these handful of kind of neighborhoods across the city where we know the rates are the lowest. And so again, I think we're, now that the dust is settling a little bit, and I just hired a new CMO who started last week. That is absolutely something that we'll be looking at.
I went out with some of the vaccine ambassadors
a
few times, door to door, talking to people who weren't vaccinated. And it is really impressive, to say the least, how people can connect and talk in a way that really respects people's, even their resistance to vaccines, because they have different kinds of shared understandings about what's there. I remember one conversation, which really the tenor of it turned when the value ambassador said, who would you get vaccinated for? The person said, my mom, I'm going to her house for dinner tonight. And they had a whole discussion about the dinner plans. And by the end, they were ready to get vaccinated. So continue with community health workforce. I want to talk about the two other kinds of partnerships, and then we'll start to open for questions. I would say from my vantage point, you had the major institutions of the city doing more for public health than, I was ever able to do by a couple orders of magnitude because of the circumstance.
Sure.
Because they realized it because you brought them together. And, there were certain things that they did for public health when I was health commissioner, and I really appreciated it. But just the scale was so much
Sure.
more. We don't want them to go back to just seeing patients that come through the door, right? What is on your agenda for the Care First, the University of Maryland, the major institutions of the city for health as COVID starts to fade?
Well, I think the good thing is those conversations are still ongoing. And so, have visited University of Maryland, and I'm excited about a lot of the things that they're trying to bring to West Baltimore as it relates to primary care. So I do think that for many of them, it was this, I don't want to say wake up call, but it was this reminder, right? That part of our charge and part of our mission should really be around serving the community. So many of those conversations are ongoing. I know Care First also has a significant commitment to supporting city residents and to being located in the city, but also they have an interest in community health workers and how, to better utilize community health workers again to do much of the work that we mentioned around, vaccines, but certainly many other health challenges that residents are facing. And likewise with Hopkins. And so still working with hospitals around housing residents who are unstably housed. We still have, residents who are still unstably housed that need isolation and quarantine. And so we didn't talk a whole lot about the Triage Respite and Isolation Center or the Tri-Site, but we did partner with Hopkins in Maryland to provide clinical support and case management support during the pandemic for residents who were, again, unstably housed and didn't have a place to safely isolate or quarantine. And so in that partnership, certainly not only did we provide the clinical care, but we helped people get identification. We helped people, get access to job opportunities. And so those conversations are still ongoing. I think it's again, continuing the work, the diabetes regional partnership. So that's something that we're doing both with Hopkins and University of Maryland that uses a similar model of the health department, again, identifying residents who may be at risk or already have diabetes, and then making sure that they're appropriately connected to care with those centers.
And what about the more community-based partners?
Yeah, so similarly, the community-based partnerships remain critical, I think, to the work that we do. And so I mentioned the value ambassadors. So that was done with community-based organizations. I should have said that. Morgan State University is our evaluator for that. Hopkins International Vaccine Center is another helping partner. We also still have many grants that we're providing to community-based organizations who are doing the work of vaccination, and that will be ongoing as long as we have COVID funding.
So in a way, you pioneered different approaches that certainly never been scaled like that. Maybe you could find little tiny seeds of that earlier, but you really took it to scale, and the challenge is going to be to continue on those different fronts.
Yep, I agree.
One last question for me. That's a tough question, so you can opt out of answering it. I think that one of the things I really appreciated as the health commissioner is the differences between the city that I was responsible for and the counties that my colleagues in Maryland were responsible for in all kinds of different ways. Every year there's a ranking of health in different counties, and it doesn't compare comparable counties. It's just, the counties in Maryland and Baltimore is usually pretty close to the bottom. Now, for COVID, it wasn't. I mean, it's another sign of the COVID response being so extraordinary. But, there are profound differences in the quality of the school buildings, just the rest of the school buildings, the project I've worked on. There are huge differences in the demand for services, say, for people who are homeless. There were always rumors that there were buses, of places with bringing people to Baltimore. And yet, sometimes the politics can seem like people are blaming the city when the city is actually harboring a huge challenge with the inadequate resources to deal with it. And it's structural, and it is, sometimes people don't see that because it's persisted for so long.
Yeah.
What do you think, how does your work intersect with some of those, structural inequities?
Yeah, I think that's a great question. I mean, I think our work is hopefully aimed at addressing many of those inequities, right? And I think the health department to me has a few roles. So certainly we administer many programs, right? We help to vaccinate many residents across the city, or to just support general vaccination efforts by other organizations. But I think we're also intended to be the voice of those individuals, to help provide insight into what it is they need, right? And so certainly we're going to do the programs. The health department will always be responsible for administering programs, but advocating, I think, at the local, state, and even federal level for actual systems and policy change is also another key role of the local health department. Again, I've been fortunate to have support by local leadership, and so I think that there's even more opportunity as we shift out of just being so focused on COVID to begin to look at kind of larger structural challenges facing our city, and how the health department can really be a voice.
Great, fantastic. I think we have time for a couple questions. I don't know. I think now we're holding on to the microphone, so if anyone who wants to ask a question has to figure out how to put on one of these. Ah, we got a third one. Okay, good. Because we're 0 for 2 up here. You want to borrow one?
Hi, appreciate the talk. So I actually wanted to relay a conversation some people around me had, seeing some of the messaging around vaccinations, and raised that as a question. And obviously, a lot of messaging is happening at a lot of different levels. But one thing that kind of went viral was something the health department did around sort of memes around vaccinations, something on the lines of like, oh, there's no microchips in the vaccine, Karen, or something like that. And some people thought it was really funny. But sort of talking with vaccine hesitant people in my life, they were very offended by those vaccines. And sort of talking with them, their concerns weren't microchips. Many of them were veterans or new people who were veterans. So they were thinking about things like the negative impact of the smallpox vaccine that had horrible effects on people in terms of getting sick after taking the vaccine. They were saying things like, hey, if I get this vaccine, even if I don't get COVID, it might knock me on my butt for a couple of days. I could lose my job. So they weren't really conspiracy theorists. They had these very real material fears. They also had sort of institutional fears, where it's like, they would say things like, if you really cared about me, we would have universal health care. Do you really care about our community? Or is it COVID? If it festers in the Black community, it might spill over to the white community. That's the only reason you care. So it wasn't even like Tuskegee. It wasn't what I was hearing. I was hearing these sort of more institutional concerns, where it's like the only thing I literally have is my body, and they're basically having another vector of criminalizing me for decisions I make with my body. And what legitimacy do you have as an institution to even do that? So seeing those concerns and seeing the messaging of the health department, at least in that instant, not match up with that. I'm sorry. I guess I'm wondering, how do we as a community, particularly working class Black folks, what are you doing to create structural pipelines of accountability, so that, I know you said you had a focus group, but some of the people who I'm talking about will never go to a focus group, right? So what are the structures that are building in this sort of relationship where these sort of cultural understandings of, again, people like veterans and people who have these experiences can be more involved in the health department practice in general, and sort of having that be sort of how we define racial equity, as opposed to just sort of, the CSAs and the services, all that's good, but how do you have a deeper relationship of accountability to community?
Yeah, thank you for that question. I will say I didn't catch everything in the first part, but what I think I heard you ask is how is the health department working with community members to make sure that we're getting their feedback and their input is what I believe the overall question was. Is that correct?
Yeah, let me just, I think part of this, part of it was about the deep distrust that people can have, and not just community members generally, but people who are really suffering in Baltimore and also have legitimate reasons to be distrustful. And so, it's one of the points was, the Twitter account lit up Twitter for a while, but could be perceived as, not taking those kinds of concerns seriously. So, how given that and the fact that people may legitimately say, there are certain things that are necessary in Baltimore, and this whole COVID thing came and is going to come and go without dealing with it.
No, I appreciate that point. I think we didn't talk a lot about the Twitter and messaging, but I think again, speaking to trying to be a bit specific in our messaging, we knew that Twitter would work for some, but not work for others. We knew that the door-to-door canvassing by value ambassadors would work for some, but not for others. We knew that focus groups would be an opportunity for some people to provide feedback. But certainly I've received direct feedback when I'm, just walking through the city. And so I think we continue to work very closely with those community-based organizations to get the feedback and to be intentional about identifying organizations that we know are closely tied to the community, which is why, a lot of times, the state, they would come to us and they would say, which community-based organizations are the ones that we know are supporting, this particular community, because they knew that we had that knowledge already and oftentimes had already partnered with them. And so I think part of it is being consistent and not saying that, well, now that COVID is over, the health department is leaving, but really finding ways to stay present and stay engaged. Because again, I can't tout enough the work of our CBOs to vaccinate and to provide education to city residents. And so we'll continue those relationships and again, hopefully just strengthen those relationships over time by just being consistent and being present.
Hi. I wanted to ask you, there are so many different health issues that affect people in low-income neighborhoods, such as the fact that we still burn our trash next to where people live, which is crazy. And we have so many neighborhoods that are food deserts in Baltimore where people without cars can't buy fresh fruits and vegetables. What do you feel is the biggest health concern for people in low-income neighborhoods?
Let me just say, it's an occupational hazard for a health commissioner to pick one thing. Okay, so I'm just going to say that I'm with lower expectations that Dr. Dzirasa will pick one and say that that's the thing, because it's not just one.
No, I mean, I think Josh is right. I think, what you're talking about are the social determinants of health, right? And so it is going back to the health department really playing more of a policy role in helping to inform our local legislators and local electeds on how to better address the broader structural issues that exist. But yes, I don't know that there's just one.
Thank you. I'm sure you're doing this, and I probably don't know about it, but not only with respect to COVID, but in general, is there more that the health department can do to give citizens all over the city and the state a sense that we're all in this together, whatever the subject is. And with respect to COVID, I remember hearing quite a few people say, well, it's a personal decision and I decided not to do it. And if there could be a way, I'm sure there is, of saying it is a personal decision, but it affects our community. So if you want to help the community to destroy this plague, then we need to get you vaccinated. And I'm using a COVID example, but I think that the sense of community, in addition to the individual spirit, is very important. What have you done?
Yeah, I'll start, and I'm sure Josh has thoughts too. I think it's a fine line, and I will say I think the pediatrician in me, the parent in me, does want to respect that people can make personal choices, but also recognizing that I have access to data and maybe an understanding of what those personal choices lead to and how they may have a greater impact. And so I think we try to communicate that certainly throughout the pandemic. I think, I'll even use the dashboard as an example of, when we kept certain measures in place to protect the broader public while other jurisdictions didn't keep them in place, pointing to the data, pointing to the fact that Baltimore City has 11 acute care hospitals, right? More than any other jurisdiction in the state. And so while our decisions certainly were specific to Baltimore residents, we were trying to protect the broader healthcare access and support for the entire state. So I think we try to do that with some of our messaging, but again, recognizing I think a lot on vaccination, things were so politicized that it did become, this very like, oh, it's my personal decision. Again, I'm a pediatrician, so I get, that we all have this sense of wanting to make the decision. And so I think that's where, again, the kind of the one-on-one engagement, depending on what the topic is critical. But I do think we try to do that during the pandemic and walk that line.
I would just say, if you were to take a scale of 10, everyone believes we're all in it together, and there are decisions that have to be made for protecting all of society, and 1, nobody believes that, and everybody's an individual. Baltimore was pretty close to 10 on the national scale. I mean, maybe it was an 8.5. I hear from people all around the country where they're at 2, 3, 4. And I think one of the things that was really remarkable in the pandemic is how the city really held together. There were professors flying in from Stanford to write briefs. Maybe they were sending briefs by electronic mail, but trying to reverse what Dr. Dzirasa had done and couldn't do it in the courts with support from experts, citizens, the mayor, everybody. So I, from my perspective, you could look at the 8.5 and go, how come it wasn't 10? Which is what my mom did on any quiz that I got 8.5. And she's here somewhere, I think. But really, the cup was largely full in Baltimore. And believe it or not, even though you may have a neighbor here or there who might have felt differently, the city as a whole really responded like a city. And I think that Dr. Dzirasa gets an enormous amount of credit for that, and just the way the city came together. And that is the kind of base that needs to be used to leverage on other issues, to try to get more agreement about compassionate ways and appropriate ways to deal with the overdose crisis, which is killing an enormous number of our fellow neighbors and residents in Baltimore. We haven't had that kind of coming together. We're down at and I'll just say maybe 4 or 5, depending on what policy people are talking about. But for COVID, the city came together quite remarkably by comparison to a lot of other places.
Thank you for that. And your last comment have caused me to reframe what I'm saying a little bit. And it's a question for both of you. So here we are a couple of years out. My anecdotal sense is that our poorest citizens our poorest citizens, our poorest families are in greater pain, have been more directly affected by COVID, directly affected by the violence pandemic, been more directly affected by school absence and learning losses, had more challenges in figuring out how to get back to and stay in the workforce, et cetera, et cetera, et cetera. My original question was, what's the role in public health in helping us move forward from that moment? But then my revised question is, how do we build on what we've learned through the first part of the pandemic to address the next phase of that huge challenge?
And if I give a little bit of the first answer here, I think when Dr. Dzirasa said something very important, that COVID really exposed profound inequities, not only within Baltimore, but between Baltimore and other places. And, you know, dealing with it in the middle of a pandemic, it was an extraordinary job, but those inequities are still there. They exist on these other issues. They exist for kids in Baltimore. I study one little part of that, which is the condition of schools in Baltimore compared to the condition of public schools in other cities. And we're using public health techniques to show that by far the vast number of school components that are more than 30 years past their lifespan. So you've got their lifespan and then 30 years are in Baltimore City. By far the greatest proportion of school conditions that pose a threat to life and health are in Baltimore City in the state. Most schools that are in such poor condition that they'd be viewed as shabby and, you know, pose different kind, you know, they're breaking down. Baltimore City has more schools than any other jurisdiction in that. And if you look at the gap in the sort of value of air conditioning units in city schools, Baltimore City is off the chart. And we put up a website that just goes like all the way negative for Baltimore City, and everybody else is over here. Baltimore City is all the way over there. That is not just something we should take for granted. You know, that's not something that we should just say, well, it's always been like that. Like COVID opened our eyes to this, and the kids who suffered, they deserve good school buildings. You know, they deserve a lot more. And I think people should, you know, what public health can do partly is to expose that, but work with education, work with others to say like this can't, you know, continue anymore. And so I think that you're asking the right question, and the answer is that we have to look at, you know, what's in front of us. The public health can help with that, and we have to get just as motivated about those issues as we were motivated in our own lives about COVID.
No, I mean, I think Josh summed it up perfectly. I think the only thing I'll add is going back to that partnership, right? And so recognizing that public health can be the voice, but we've got to be the voice working with elected officials, right? Who have the power to change legislation, you know, working closely with city schools, who was a great partner in vaccination to perform the vaccinations. Working with our local community-based organizations who know the communities far better than we can and can help to engineer those solutions. So I think it like everything that we've done in COVID has to be done in partnership, you know, with other leaders, with other organizations, with other entities that can affect the change.
Hi. I just really want to thank you. I think you are doing the right things, the boots on the ground, this whole idea of relationship building to tackle these problems, I think is terrific. And I just am so grateful I was here to hear you talk about it.
All right. Well, thank you for taking us on this journey. And I personally want to thank you for both of you for your leadership, but also for going door to door and just doing the work and centering all of the human beings in our city. Meant a lot to all of us and to our community. And we just really appreciate everything that you both have done and the fact that you took the time to be here with us tonight. So thank you. Also want to say thank you to the Church of the Redeemer, who has always made the Thread community feel so at home here and has welcomed us into your space. For those of you who are interested in continuing along with us for the next few weeks, the speaker series is going to continue. You can join us next week virtually. We will be joined by Mayor Brandon Scott and lobbyist Delora Sanchez Evacauche. More importantly, a Mervo and a Dunbar graduate. So you can go to thread.events/speakers to register. And we hope that you will continue to think of ways that you can, again, find folks to build relationships across lines of difference in our city and get to know one another. And just appreciate you being here with us tonight. Thank you.